A crucial new health reform that could affect all Australians will come into effect on the 1st of July. It's a vast electronic database to store the personal health records of all Australians who choose to opt into it. E-health means patients' records will be shared by doctors, specialists and hospitals. The government says it'll save lives and make things easier for many chronically ill people. But just 2 weeks out from the start date, key sticking points, from legal liability to privacy concerns, still aren't resolved. Heather Ewart reports.
Got some results about you, so thanks for coming in. I want to just run through those with you. Is this from your kidney doctor?
Doctors' surgeries are a regular feature of life for this retired truckie from Melbourne's western suburbs. Barry Freeman is 64 years old and has serious health problems.
Well, I'm a diabetic. I've had a kidney transplant, had my cataracts done in my eyes. With the kidney transplant, I have medication and they create skin cancers and all that sort of stuff.
And that's your trusty book you have there where you've been writing all your stuff. Can I have a quick look at that again?
Barry Freeman sees 6 different doctors and specialists to manage his health. On this day, it's yet another appointment with his GP. He leaves nothing to chance. Since his kidney transplant 24 years ago, he's carried around a little black book containing all of his medical details.
That has got all my information from Pre-Centenary Hospital when we had the transplant. The doctors had done it, all my medical blood types and that sort of stuff.
So you wouldn't want to lose it?
No, no.
That's extraordinarily rare. You'd be very lucky to find anybody with a large history like that with any such book.
From July the 1st, the book should no longer be crucial. That's when registration opens for personalised electronic health records, known as e-health, where a patient's medical summary can be shared via the computer by health professionals. Barry Freeman will be one of the first to sign up to this major technological shake-up of an industry that for years has relied on handwritten records and faxes.
Look, it's a whole new way of doing business. And of course it gets a bit scary when you do something different. Any change brings that. It doesn't replace good clinical method of asking patients questions, but it means that he doesn't feel like he's being grilled by the Gestapo.
What sorts of things do they ask that you have to repeat over and over?
Oh, just medication mainly. And what I've had done, operations, that sort of thing.
Under e-health, this should become a thing of the past, and no one's more confident of that than Barry Freeman's GP, Dr Mukesh Haikerwal, who's also the clinical advisor to the National e-health Transition Authority. In fact, there doesn't seem to be much dispute anywhere that the idea, in principle, is a good one that could save lives.
We share the vision. Now, we do see a great benefit to the Australian community ultimately if we can get this right.
There are potentially very large savings both in time and money for the health system, which otherwise is expanding at such a rate that at some stage it will become unaffordable.
So there are some really good positives about this, but there are some hills that we've got to climb to get over the medical legal concerns which still exist to this day.
Just 2 weeks out from the start to e-health, there are serious legal sticking points yet to be ironed out with the government over how the scheme should work in practice.
What is my liability? If there's a record there and there's lots of information, does my surgeon colleague, does my obstetrician colleague have to read every single document on there to reduce their litigation risk? Yes or no?
Well, I'm not sure we're going to make it by July 1. I mean, we clearly won't be able to provide a recommendation to our members, neither will the medical indemnity insurers who recognise the extra risks that it will put on practices by July 1. I mean, we are in discussion with the department now.
These are questions being thrashed out at the 11th hour by insurers and GPs representatives with the Health Department. And the government says it feels positive they will be resolved by the starting date. But there remain key areas of confusion and uneasiness amongst the health profession and consumers.
What control will patients have over the record? Will they be allowed to withhold parts of the record from the medical practitioners who are going to be treating them? And what impact does that have on the care and the quality of treatment that they get?
If the patient says to me, look, I've got depression and I'm on this drug for the depression, I'd rather that didn't go up, we would have that discussion. I would say to the patient, I don't think it's a good idea for you to hide the depression because you might not get the optimal treatment if you rocked up somewhere. Choice, I don't want the record, or I'm happy for that to be included, but if it goes up there and it's included, they can't delete that bit.
Any side effects, any problems?
No. The eHealth summary would normally be prepared by a GP in consultation with their patient, who would have personalised access to the record at all times. The linchpin is a health identifier number assigned to all Australians under legislation passed 2 years ago.
I've got my own file number here. In the future, I wouldn't need to use that. I would be able to use the new health identifier system.
And this raises concerns about privacy.
Once the information is in the system, it's always available to somebody, no matter how many restrictions you put on it. And we've seen in this recent time that the degree of hacking, the degree of unauthorised access to government databases is already quite substantial.
There are many things that we can do to reduce risks, not sharing passwords. Actually making sure there is a password there before you can get onto a file. Making sure that you've got firewalls.
We can get the results with a minimum of fuss with a click of a mouse button.
The government says the eHealth system will have bank-strength security features in line with the Defence and Attorney General's departments, a point reinforced at 12 eHealth test sites around the country, run by the National eHealth Transition Authority to give clinicians and consumers information.
We've done over 750 consultations as NETA, over several thousand people in a very short length of time to get people to the fountain ready to drink.
But the majority don't appear to be actually rushing to the fountain yet, and here could be one reason why.
There is no business case at this stage for specialists to sign up. There's no business case for hospitals to sign up. In fact, there's no business case for the individual doctor to sign up to this electronic health record.
In other words, the doctors want more money to update their computer systems and to charge more than standard consultation fees to compensate for what they say is an extra workload.
The government seems to be saying that if you do extra work, there's no extra remuneration. There's certainly no recognition that this is not the same as a normal standard practice consultation.
The Minister for Health, Tanya Plibersek, was unavailable for an interview, but in a statement to 7:30, she said the government had provided more than $160 million to GPs across Australia to upgrade their systems. And there'd be another $50 million given to Medicare locals over the next 2 years to help GPs adopt eHealth. As an eHealth truck tours the country promoting the benefits, the government is playing down the scheme, bringing immediate results from July the 1st, saying the rollout will be a slow, steady process. So, Barry Freeman isn't tossing out his black book or silver chain containing his medical details just yet.
Heather Ewart with that report.